My name is CJ Grunstead. My major is psychology and my field of study is mental health care counseling. I selected to focus on being published in a professional magazine for its wider range of audience. The magazine that I chose was Psychology Today. I went with this decision based on its wide range of articles and its wanting to appeal to the masses. Magazine articles that focus on mental health care tend to focus on diction, pathos, and logos. While some magazine articles focus on a common man audience with trying to appeal to their empathy, other articles are trying to engage with counselors, psychologists, psychiatrists, etc. by intriguing their minds with logic and ideas with findings from research studies that can further dive into their own if they feel so inclined. While both kinds of articles have their balance of pathos and logos, their difference lies in their diction. The common man's article will use more inclusive language, whereas articles focused on professionals will carry academic weight to it with terminology the everyday person may not be familiar with. For my rhetorical comparison paper, I focused on diction, tone, and research presentation. For my wit paper, I changed out tone and research focus for logos and pathos. In my rhetorical comparison paper, I thought it was important to focus how it sounded to the everyday man. I was imagining what it would sound like if someone who has never shown an interest in mental health picked up a magazine in an office waiting room and was just leafing through the articles. How would I want to get and keep their attention? I wouldn't want my article to be standoffish or imply that somehow with my level of education I am better than them. I wanted them to take into consideration what ideas I'm putting forth in hopes that they would want to explore them further on their own. So I'd want them to be easy to comprehend without needing to know medical jargon to understand the point, which is why I focused on diction for both of my papers, but turned my focus to include logos and pathos for the WID to strike at a person's need for survival and feel motivated to make changes in both their personal life and their society's culture. My initial plan for my WID paper was to find a way to bring awareness to the need to make mental health care take up a bigger role in people's lives. What I saw surrounding the discourse of mental health care was a lack of covering the struggle to not only access mental health care, but making it more commonplace to think about in a person's everyday life. As Americans, we are conditioned to suffer alone when it comes to our mental health. There are people who are having gallbladders removed because their gallbladders are attacking their bodies for ignoring the stress that they put them under. This should not be the case in the modern era. So to address the gap, I wanted to see what we're doing to make mental health care accessible in every sense of the word. For my proposal, I wanted to focus my attention on accessibility and what that means to everyday people. I wanted to see research being done on ways people are making mental health care more open, understood, and available. I want to address my concerns for today's society and its aversion to seeking help for their mental health problems and their lack of understanding of what these problems are. For my first piece of research, the article Getting Mental Health Care When It Is Needed, I wanted to see what people who are well informed about the mental health care scene thought about the level of access we have today and what we could do to improve it. This person's idea was to start taking mental health surveys at people's yearly physicals to make mental health care more aware to everyone and to help intercept a problem when it was warranted. I did not bring this idea up in my own paper because of my focus group, which was college students, may most likely skip yearly physicals if they were not ordered to have one. However, I did keep in mind on what they had to say about the subject of accessibility, as they have been written and edited papers on the subject for a number of years. For my second piece of research, the study Self-Reported Barriers to Professional Help Seeking Among College Students at Elevated Risk for Suicide. This was my most referenced and important piece of research because it included direct comments from students themselves about what hurdles they face when it comes to seeking treatment. Of all of my research, this was the only one of its kind to do that, and I thought it was vital to include when writing my paper. For my third piece of research, the study Mental Health Treatment Barriers Among Racial and Ethnic Minorities versus White Young Adults 6 months after intake at a college counseling center, I thought it was important to see what the differences were in barriers between white people and people of color. There are disproportionately fewer people of color seeking treatment than there are white people. I wanted to understand what the causes of that were. For my fourth piece of research to study the impact of experiential exercises on communication and relational skills in a suicide prevention gatekeeping training program for college resident advisors, I wanted to see what steps were being taken by school campuses in helping with interceding college students who are suffering with suicidal ideation. Although this is an important step in getting students help, I thought that more should be done to help students address their problems before it becomes to suicidal ideation, rather than just have our eyes look out for those who have come to them with thoughts of suicide. For my fifth piece of research, the study, an audience research study to disseminate evidence about comprehensive state mental health priority legislation to U.S. state policymakers protocol, I wanted to know what steps were being taken on a government level to make mental health care more accessible for everyone behind the college student. The results were disparaging, but steps are attempted to be taken. It made me aware that more needed to be done to make mental health care more accessible on a grassroots level if we wanted to see better change for our government policy regarding health care. For my sixth and final piece of research, the study Balancing Accessibility and Selectivity in 21st Century Public Mental Health Care Services, Implications for Hard to Engage Clients, I wanted to see what ideas were being considered with figuring out how to reach hard to engage clients. This focused on people outside of the college education system, but it was important to see what was waiting for students once they have left college behind. My annotated bibliography covered everything that was needed for discussion in my wood paper. It gave explanations for what was needed and neatly summarized everything that was researched. It pointed out things that needed pointing out without giving the details away, so the study still made for an interesting read. My guided research question is, are we doing enough to make mental health care accessible for college students? The answer that I found was not only are we not doing enough to make it accessible, but we need to expand our ideas of what it means to make it accessible. So my thesis statement is, college campuses, along with our societal structure, are not providing adequate accessibility for proper mental health care. They are not being provided with enough knowledge, support, and financial assistance when it comes to taking something so vital in their lives, and these actions are making for disastrous consequences in their future. My WID paper had 8 key points about what kinds of barriers students face, and I broke them into 3 groups. The first group covered how colleges should assist students with time, cost, and support, which are the 3 fundamental barriers that students face in regards to getting help for their mental health. The second group focused on not being able to obtain the right services due to lack of transparency, lack of understanding, and insurance bureaucracy, which are barriers on a more education authority level that could be addressed with well-staffed, informative counseling centers that either provided free access or operated on a sliding scale to get past the need for insurance, but also educate the student populace on what to look out for in their mental health while they were pursuing an education. The third group covered the stigma that people face when it comes to getting professional help for their mental disorder, but also it talked about how we normalize ignoring symptoms of stress, anxiety, and depression, and just assume that this is supposed to be a part of our daily lives. These key points focused on barriers of an abstract level and how we need to start promoting ideas like self-care, being more open and vulnerable, and just talking more about internal struggles outside of a professional mental health care setting while still stressing the need for visiting professional mental health care providers. Throughout this presentation, I have been talking about the supporting ideas, research, and examples of my WID paper, but I haven't touched on any examples. I feel as though the best example for my paper are the quotes from the students in the self-reported barrier study, such as, "I do not have much time to get all my coursework done, eat, and sleep. Trying to fit in additional commitments is very challenging and stressful," as well as, "I don't want others to know what I'm going through. If I were to go to one of these places, someone could see me going there or on an insurance bill." Nothing is clearer than we are failing our students that these self-reported claims, along with a small sample of 165 students that responded to the self-reported barrier study. Each student touched on two or brought up one of my key points that previously stated earlier, and they have helped shape the focus of my WID paper. I hope that this presentation has helped answer my research questions and support my thesis statement. Mental health should not be ignored. Though we currently face many challenges that attempt to prevent us from getting care, we need to take it upon ourselves to find ways to receive the attention that we deserve. We need to start paying attention to our minds' needs and address our issues before they develop into more complicated health problems. We need to take time out of our days to put ourselves first and make sure we are not ignoring the stress, anxiety, and sometimes depression that we face when trying to get along in this life. We also need to come to accept that mental disorders are not only normal but common, and trying to get by without addressing them with medication and therapy makes for a short, complicated life. Do not suffer in silence, and don't let your fellow man suffer in silence either. One of the best steps forward in getting help is to start talking about these things in an open discussion without shame and without judgment.